We are joined by Will Humble. We thank you very much for taking the time. First and foremost, what we're seeing, the transmission, the rate of the numbers, is this about on par with what we've seen in other countries and possibly other areas throughout the country?
I think Arizona is doing better than many other states, and in part that's because we were lucky enough to not get a big influx of cases several weeks ago. So if you remember places like in Washington State, for example, they got really early cases and had community spread a few weeks earlier than we did. And so that gave us valuable administrative time to start doing some of these administrative things, you know, the social distancing, some of the executive orders, now a shelter at home order. And so we're in a better position than some other states because we've had more time. So I think we're ramping up at a slower rate than places like Washington and you know, some places in California and for sure New York. And I think the big part of that is having a little bit more time to get ready.
And let me ask you this, the numbers that we're seeing, and they are, steadily climbing here, are they the number of tests or are they an accurate number of those who are infected?
Oh, well, so these are confirmed cases. So these are people who actually had one of the nasal swabs. It went to a laboratory, it came back positive, and it was reported to the state database. And so the numbers that you're looking at are a portion of what we're seeing in the community, because there's a lot of folks who might feel unwell, but decide, look, I'm not going to an emergency department, I'm not going to go to the community health center, I'm going to ride this out at home, and if I have trouble breathing, I'll do something about it. Those folks don't get the test and don't get confirmed. And then we know about 35% of folks that get infected with the virus, we know this from the Princess Cruise data, are asymptomatic. And so you have the asymptomatic people who feel badly but don't go in and get the test. They're out there in the community too, not just the people that get confirmed.
What about the people who are being turned away right now because they don't have the most severe symptoms? And there are certainly a lot of them. We get a lot of messages into the newsroom. Are we going at this blindly if we don't have an accurate count of everybody who's infected out there?
The important thing right now is that we know we're in what we call community spread. So we're in the phase of this epidemic where you have to operate under the assumption that the folks that you meet might very well have the virus and could be asymptomatic. And so the actual numbers reported on a website are really not that important. What is important is for everyone to recognize that we're in the community spread phase. That data is going to be valuable on the reported cases because it's going to, at some point we're going to see a peak and a leveling out and then a decline. And that's valuable information for policymakers, appointees, and elected officials, because it gives them some clues about when we can dial back some of these social distancing measures that are having such a dramatic impact on the economy. And one of the things I keep remembering to our members at the Public Health Association and others is, there's more to this epidemic than COVID-19. The interventions that we're putting in place are having a dramatic impact on the economy, and that has a real impact on people's lives and health outcomes in other ways. And so it's important to get that data, track it so that we have better information about when we can dial this back, because that's important too. Okay. Dialing back is important as well.
Let me ask you this, because a lot of those folks who we've heard from are being told, hey, even though you have symptoms, the best medicine is to just go home and quarantine for 14 days. Is that the proper message to send to the folks?
So, well, there's two categories of folks. I blogged about this the other day. There's isolation and quarantine, and they're two different things. Isolation means you've been identified to have the virus and you're ill. That's really important that you isolate yourself if you've got a room inside your house, to stay in isolation and don't come into contact with your family members. Quarantine is a different thing. That's somebody who's been exposed to somebody who's positive. Okay. They may or may not get the illness, and so quarantine is less dramatic of an intervention. It means doing what you can to limit your exposure to others, maybe stay in the house, but it doesn't mean you need to stay in the exact same room of the same house for 14 days. You're on quarantine, not in isolation.
All right, good information as we continue to learn more. Thank you very much for taking the time this morning. Guys, we'll send it back and we'll continue talking with Mr. Humble here, and we will put more of that on our website and have more in later newscasts. We'll send it back to you guys.
Javi, real quick, some of the headlines that I've been seeing float around this morning, I apologize if you touched on it and I missed it, but on CNN for one, as well as other news outlets, they're saying experts are telling White House that coronavirus can spread through talking and breathing. Is that something that's popped up that's new right now?
Yes, and he and I were just talking about this before we came on camera, talking about the droplets and how social distancing, even though you know, you're 6 feet apart, that it's now aerial, and that's what they're learning. Yeah,
so this is a droplet spread virus, just like influenza is a droplet spread virus. And you know, there's the imperfect information. We're still at the beginning of this epidemic. A year from now, we'll know a lot more about this virus than we do right now. Right now, the guidelines are to stay 6 feet apart. CDC is looking at that carefully, and if they decide that there's reason to change those recommendations and make that 12 feet or something, I think we'll see that. The important thing right now is for people to really take this seriously and on a day-to-day basis make decisions all day long to try to limit your exposure to other people, and when you do need to be close, or if you need to go down to the store to get something, to pay attention to the tape lines that are in the store and be courteous to the other customers and do your best to keep your distance.
Space is important right now. All right.